Post-concussion syndrome occurs after head injury. It may occur after mild, moderate, or severe traumatic brain injury. It occurs after a blow to head with violent shaking and movement of head or body. Symptoms of headache, dizziness, vertigo, memory impairment last beyond expected recovery period of weeks to months. Loss of consciousness is not necessary for post-concussion syndrome. The risk of post-concussion syndrome is not associated with severity of injury. Symptoms of post-concussion syndrome last for 7 to 10 days, may last for even to 3 months or even to 1 year or more. The symptoms of post-concussion syndrome are headache, dizziness, vertigo, tinnitus, behavioral, symptoms of irritability, anxiety, insomnia, fatigue, loss of concentration and memory, blurred vision, noise and light sensitivity, rarely in some patients. Decrease in taste and smell can occur. The summary of symptoms includes central symptoms, headache, dizziness, vertigo, tinnitus, concentration, smell, blurred vision, and behavioral symptoms like irritability, anxiety, insomnia. Now, the etiopathogenesis of post-concussion syndrome. The pathophysiology of post-concussion syndrome is not well understood, but structural brain injury on macro or micro level involving axons, synapses may be cause. Although exact cause is not known, risk is increased in previous history of depression, anxiety, post-traumatic stress disorder, post-social, poor social support system and lack of coping skills, increasing age and female gender. So, the causes have been described. Now we move to the investigations and treatment. The neuroimaging like CT and MRI brain are normal unless there is severe traumatic brain injury. Advanced neuroimaging techniques like positron emission tomography or PET, single photon emission computed tomography may show decreased glucose utilization and cerebral blood flow abnormalities. So, routine investigations are not necessary in post-concussion syndrome unless severity of injury has been defined previously on initial scan after head injury. Now, there is treatment of post-concussion syndrome. No specific treatment is needed for post-concussion syndrome. Tricyclic antidepressants, anticonvulsants can be used for persistent post-concussion headache, like migraine. Antidepressants, anti-anxiety medications can be used for depression. Psychology counseling, cognitive therapy, focused rehabilitation can be provided to provide training in specific areas needing strengthening. Memory concentration, behavioral issues require relaxation techniques. And for management of persistent post-concussion syndrome, you may require opinion from neurologist, psychologist, psychiatrist, occupational therapist, and speech therapist if needed in some cases. You may require neurosurgeon, consultation with neurosurgeon if there is any insult or any fracture or hematoma contusion which has yet not been resolved. So this was post concussion syndrome. I think this was brief introduction from etiopathogenesis to symptoms, diagnosis and treatment. Thanks for your precious time. Thanks for watching. In the end, please don't forget to share and subscribe. Thanks again.